Hi, everybody, and welcome to our Knockout Opioid Abuse Day mini webinars for this year's Knockout Opioid Abuse Day program, which we hold statewide every year to address the issue of opioid abuse in this state. We're so grateful to have you participate. And today we have a very important presentation and another great resource and information on Operation Helping Hand. So I'd like to introduce Danielle LoRusso and Felix Pacheco, the peer-to-peer learning coordinators who will discuss the program with you. Danielle?
Hello, thank you for having us. So I just want to introduce myself real quick. So my name is Danielle LoRusso. I'm a retired sergeant. I have 25 years in law enforcement. 23 of those years was dedicated to working undercover narcotics. The last 2 years was working community policing. So I kind of worked in narcotics my entire career. Towards the end of my career, I really understood substance use disorder, which threw me into my retirement, becoming a recovery coach. I should say I took the recovery coach training because just taking the training doesn't make you a recovery coach, but I did take the recovery coach training and I learned how to be a recovery coach, and I'm still learning. But I was very fortunate to get hired with the Attorney General's office and joining the NJ Cares team. So what is NJ Cares? NJ Cares is the Office of New Jersey Coordinator for Addiction Response and Enforcement Strategies. NJ Cares. Responsible for overseeing addiction fighting efforts across the Department of Law and Public Safety, creating relationships and partnerships with other agencies and groups, committed to identifying and implementing solutions to the opioid crisis and substance use disorder. njcares.gov. I encourage you that when you get done watching this, please go visit this website. It's a phenomenal website. It's dedicated to providing you information, the public, information on exactly what is going on the state opioids crisis. It is broken down by each county. So I'm going to the next slide. So as you can see, it's broken down by each county. You just click your county. All the information there gives you the past history and the current history of what's exactly going on right now. It's updated at least every 3 months, which is bi-quarterly. We make sure all the stats are updated on there. It gives you data by overdose deaths that we have unfortunately have had. It gives you the Narcan deployments. It gives you opioids that are prescribed within your particular county. And then if you look at the bottom, it gives you a bunch of resources. Where to obtain Narcan, gives you information on treatment, also safe disposal sites, community resources within your community. And then it also has training events. So the calendar at the bottom, click that, you open it up, it's going to give you anything that's going on in your area. Then of course there's our resource guide, which is Operation Helping Hand. And then there's an information clinic for clinicians on the right. So what is Operation Helping Hand? Operation Helping Hand actually started in Bergen County. Their narcotics unit actually started it way before 2016. Bergen County prosecutor at that time was Gruwall. When Gruwall became the Attorney General in 2016, he actually brought the program with him, and then we piloted in the state of New Jersey. So Operation Helping Hand objectives. We are understanding how the OHH provides comprehensive support to initiatives and individuals affected by substance use disorder, describe how law enforcement through OHH collaboratively works pathways to recovery for individuals who may otherwise not be offered assistance. And we're partnering with people throughout our own particular areas to make this work with us. We're obtaining different perspectives to gain a better understanding of substance use disorder. So we're actually going out there and we're educating law enforcement officers on understanding the cause, signs of addiction and substance use disorder, how to handle individual law enforcement encounters in the field that have substance use disorder, de-escalating strategies, which is amazing and it's one of the things that I love the most, linkage to care, which is huge, evidence preservation, partnering with local, state, and federal resources so each county can tailor fit their individual counties with their needs. Not everybody has the same manpower and the same resources, so this is amazing that we're able to do that, and utilizing available data resources to monitor and target individuals in certain hotspot areas and locations, which Felix is going to be explaining that in a few minutes. In 2019, so I did tell you that when it first came up into our state from Gruwall, in 2019, it expanded to all 21 counties. Everybody is participating in Operation Helping Hand. It's a county-based prosecutor-led diversion program. And again, it's law enforcement playing a proactive role in connecting individuals with substance use disorder to treatment and recovery services. Some examples that we have listed here, there was an arrest approach, but the most popular one is the non-arrest approach. And it's having programs going out there, operations out there. So we're connecting with individuals. It's law enforcement with the recovery support services together, with going into the community, identifying people that are struggling. And we're also doing community events, and we're also doing a court diversion program. Now I would like to introduce retired Captain Felix Pacheco. Felix.
Hello, everyone. So I'm going to cover our OHH partnerships that we've went throughout this inception of this program. But before I start, I'd like to tell you a little bit about myself. So I am a retired captain from the Hudson County Prosecutor's Office. I did over 25 years with the Prosecutor's Office, starting originally with the Hudson County Sheriff's Office. Predominantly, my career was in narcotics, gangs, and violent crimes. I rose through the ranks from a on-loan sheriff's office to a detective with the prosecutor's office, and then all the way in 2014 as becoming the captain and commander of the guns, gangs, and drugs unit. So what I'm going to do is now talk about the partnerships that we have created throughout this program. And the first partnership I'm going to look to discuss is our partnership with the state police, which is with the DMI at-risk matrix ARM report. It is a tool that we utilize to assist our partners in determining the individuals who are most at risk. We provide this tool to our law enforcement partners, and they're able to go onto the program and implement the information. So this program is drug-related data is leveraged to inform Operation Helping Hand partners by being armed with the intelligence, and we use the arm is to have that intelligence at a click away by just going on to this program. It identifies and supports at-risk areas, populations, and people in most need of assistance. These are individuals who most likely need more intensive screening, intervention, and services and support. Next slide. So our continuing partnership, we started again, as we said, it started within the counties and then broke down into the municipalities and the counties. But our partnership expansion has expanded to New Jersey Department of Homeland Security, other OD2A sub-recipients inside and outside of New Jersey, OHH, and new CDC hires, linkage to care coordinators, peer recovery coach, New Jersey State Police, as I mentioned earlier. Our new partners right now are Division of Criminal Justice, the drug recognition experts. New Jersey Transit Police is another partner that we've incorporated and have funded. And then we also have training that we do for the New Jersey Police Training Commission, the PTC, which was just recently granted that we go to 21 counties that have police academies, and we provide training to the new police recruits. We also provide training for first responders and EMS and firefighters, family physicians, and OHH National Conference, which is something that we're going to look hopefully be implemented within the next year or so. Due to COVID, it was something that we've been trying to go back and forth and get involved in, but we look forward to that partnership with the National Conference. Next slide. So here is the data, and the data by counties. So what we like to do is we like to tell you, provide throughout the data is these. If you look at the pie chart, we have like the rest-based at-risk outreach, the community deployment, and everything's geared by county, by all 21 counties. Diversion programs, what we call is a knock and talk, which is one of our popular programs that we like to do, and we're gearing away, like Danielle had spoken about, gearing away from the arrest-based models and going to the knock and talks where after somebody interact with law enforcement, interacts with someone that's suffering from substance use disorder, we'll go back and follow up with them and to see how they're doing. A lot of counties are using these mobile vans that are very they have the van wrapped so everybody knows what the van is about, and it's a station where they could go in, and it's very inviting, where they go in and they park it in certain areas of their county, and they look to interact with individuals that even if they have questions about the van, and then we'll have all the resources, pamphlets that are inside there, and then there are times where they'll have our recovery specialists inside the van waiting to interact and provide services. Next slide. So you can see here are the traditional data, right? Over here from 2018 to the present. You can see the total law enforcement encounters was over 11,725. Then you can see as per those law enforcement encounters, then we can see that to the right, the total individuals that accepted services from the law enforcement encounters, a little over 4,000. Next slide. So these are the total types of law enforcement operations. So you can go to look to the left if we highlight arrest-based operations, which you can see that they've died down from the times that we've done it before, a little over 1,000 from 2018 to the present. And as the law enforcement encounters, right, that you see in the lime green, individuals are accepted and offered treatment and recovery services as a little over 700. And then now you look at what we're doing now, which we're pushing is a non-based operations. You can see how it's increased to a little over 10,000 in operations that we're doing throughout the inception of this program. And then again, you can see the non-arrest based operations that are just increasing. And as a result of this, the individuals that are that have been arrested and put into diversion programs, you can see the numbers here, which is a little over 349 of individuals for law enforcement encounters, and then of the 349, 255, which is incredible. Of those 349, 255 have accepted treatment or recovery services. So the first individual we're going to speak of is his name is Paul. Paul developed a substance use disorder issue after serving in the U.S. military in Iraq and Afghanistan. In 2019, he was homeless and struggling with opiate use disorder. He was in trouble with local police and was even contemplating suicide. After getting connected with OHH, Paul was able to get connected to treatment. Today, he is a dean on the dean's list and an honor student, and a co-founder of a nonprofit to help other veterans dealing with post-traumatic stress disorder. So the second success story we like to highlight is Gary. Gary is from Somerset County. He is 40 years old, is a lifelong Somerset County resident, a homeowner, a husband, a father with 2 children, and a union electrician. Gary stated that he started using substances at a young age, but over the last 10 years, he became overwhelmed with many different life challenges and started using more dangerous substances. As a result, Gary suffered an overdose that required Narcan reversal by law enforcement. When Gary was contacted through the Somerset OHH team, he signed up for services, but shortly thereafter decided to recover on his own. Several months later, Gary reached out to his recovery specialist and took the extra steps, requesting the support he needed. Since that day, Gary has been working closely with his recovery specialist. Gary stated that he recently acquired a boat, and with his family by his side, they enjoy spending quality time together. Gary reports that he now gets to enjoy many luxuries as a man in recovery that he could not have dreamt of previously. Gary is very grateful for the initial outreach by the Somerset OHH team and the crucial recovery support that the R4R has been able to offer him throughout this journey. And this last recovery story we like to highlight is from Sean. He is a 24-year-old man who has been sober as of October 2020. His drug of choice was meth. He had been using drugs since he was 14 years old, and he was a product of a dysfunctional family with no parental guidance. At the age of 21, he was motivated by his daughter and spiritually to get sober and be guided to recovery. He was put in touch with OHH in Salem County, and he worked with the City of Angels to take responsibility in the right way to do the right thing. With the help of OHH, he got into a treatment, met his sponsor, learned how to address his mental health issues, and was able to hold down a job for the first time, and worked with DCPP to get back to his daughter, who turned 2 in November of 2020. He also dealt with his criminal charges and is currently on probation to deal with his charges. So as you see, these success stories that we spoke of highlight the success OHH has done throughout 21 counties. And there's several other success stories that we would love to highlight and go and bring into to your attention. But at this time, we like to highlight those are the main ones from each from respective areas from the central, north, and southern county part of the counties. So why families have tough time understanding addiction? Families tend to be angry and or feel lost. They take advice from other family members. They want to use tough love and kick it out. We cannot take a one-size-fits-all approach to addiction. All recovery is different. You are the only one that knows your loved ones. It's a slow process, not perfect, but when done together, there's a higher success to stop using. We use this throughout a lot of our trainings because it is so true. This term, we've always done it this way, doesn't make it understand that we're doing it the correct way. So by highlighting this term that it is a dangerous phrase, we kind of try to change the narrative of how we've done things in the past. We have to remember change is hard, especially when it involves changing behavior that was once considered to be rewarding or pleasurable. Now, everyone will want help in an initial counter or follow-up encounters. We cannot force our loved ones to enter treatment and or accept recovery services. We have to be patient. We can't take it personal. They may need a little more time before they're ready to accept help. And this is a pamphlet that we have at the end of all our trainings. There's a QR code where it can go to actually do a critique on the training to see what we would like to add to the training. So this is all the individuals that are involved. We provide their contact information, their email address. So if anybody has any questions, they can reach out to us at any time. Next slide. So here are our contact information. You can reach out to myself or Danielle anytime that you wish. That's our cell numbers. And like we said, if there's anything that we can help you with, if we're not too sure, we will find an answer and we'll definitely get it to you. So I just wanted to thank everybody for their attention and the time of listening to this presentation. And we wish everybody the best of luck. And like we have said many times before, alone we can do so little. Together we can do so much. When we work together, we succeed together. Thank you.